Hey, everybody. Welcome. My name is James Hirsch. I'm the VP of Marketing here at Prosperity Behavioral Health. And I'm really excited for this conversation today. We are going to be talking to one of our favorite near and dear customers, Harbor of Hope. They're in Portland, Oregon. And with us today is Nasteha Issak. She's the operational coordinator for them. And that's just a fancy way of saying that she wears a million hats. She oversees billing, RCM processing, and a ton of other things that we'll get into. And she's been so gracious to give us a little bit of her time today to sort of talk about the journey that Harbor of Hope has been on. So Nasteha, welcome. And also with us is Carmen Ramirez, who is Harbor of Hope's customer success representative at PBH. So Carmen, welcome.
Hi, thank you for having me.
Yeah. Hi. So Nasteha, do you want to just talk a little bit more about yourself and sort of your background and a little bit about Harbor of Hope, kind of fill in the details more than I can.
Okay, so my name is Nasteha Issak, and I've lived in Oregon since I was 2, so almost 30 years now. On and off, I've moved a lot here and there, but I've always been coming back, and Oregon has always been home. Before getting into the position that I'm in right now, I started off as a CRM in another facility here in Oregon, and I got into that through peer support roles and something that I had a life experience with my sibling who was going through rehabilitation and drug and alcohol use at the time. For me, it was like a way of trying to figure out how to help him and how to help him maneuver through what he was going through. And then over time, I think Oregon started to kind of feel different, and it didn't feel like home. The homeless population was growing, the drug use was growing, and we had more problems, especially within our Somali community. And then I know the owner, Abdi, who opened this facility with Liban, and we're really close friends. So he reached out to me and said, I'm trying to open a facility and I would really like it to be, since you have been working and you have some resources that can help us, if you would work here for us at Harbor of Hope. So I started 2 years ago. I'm kind of shocked it was 2 years now, but it really kind of took off and we kind of never looked back. So it's been amazing. And Harbor of Hope is not a place just for a specific family, of course, we want to work with people of color in the BIPOC community, but it's for everyone. And we've worked with all races and every ethnicity and backgrounds. But obviously, because we're people of color, we tend to attract people of color, and we tend to attract people in our own communities that haven't been able to trust dominant culture, different communities, and didn't really know how to navigate through things. So we've had a lot of our people as well reach out to us and ask for support and help. And it's been special because it's very not talked about in our community. It's very swept under the rug, and something that you don't get to sit around at tables and talk about issues like this. Just having that trust in the community where they can feel like they can reach out to us and come to us for these things was really important and special. So yeah.
Amazing. And we're going to dive into all of that in a second. We'll let Carmen introduce herself as well.
Yeah, I'm Carmen Ramirez. I've been with the company for 8 years. I'm also very passionate about recovery and the recovery community. And I started working with Harbor of Hope. I got a call. I was out for Christmas holiday, and I got a call from Abdi, and him and I talked through the whole Christmas break off and on. And but I've been doing this for 8 years, and very passionate about this industry. I visit Oregon at least twice a year to visit our customers up there. And I always tell Abdi, you're my favorite, because Abdi is literally this facility has persevered, pushed through, and overcome a lot to continue to serve the community that they serve. So, but Yeah, I started out with Prosperity as a just a claims rep 8 years ago, and I am very good with people. I've made it my business to learn every aspect of behavioral health, SUD, and mental health. And I love my customers now, and I've made it finally 8 years. I'm where I need to be. So
That. Well, so Nasteha, let's talk then first. One of the things I think that's really interesting with the Harbor of Hope story, you sort of just touched on it a little bit. You do serve different populations in communities. And can you talk about the different sort of communities and patient populations you do serve? I know one of the big ones is the Somali community, of which you're a part of. And I'd love to just hear a little bit about what that means, sort of, for you, sort of being um, a community, a resource, and a place where people can go to get the help that they need, which they might not otherwise.
Yeah, we've had, a lot of people come in from different backgrounds, but like I said, even though our main clientele right now is Black people and people of color, we do serve everybody. But because we're Somali and it is a Somali-owned business, they feel like they can gravitate towards us and communicate with us on how to help their, how to help support their kids or youth or young adults that are struggling at home with not just SUD but mental health as well, and finding resources for them and helping families kind of see signs and things to look out for. I used to be a parent educator, so it's really helpful to have that background because I was able to connect with families in a way that you know, makes them feel comfortable and at ease. And then my family specifically is very vocal about the things that we go through, and we talk about it even though in our community it's not something that is done or appreciated. But we've talked about my brother's struggle, and my dad and my family are kind of well known in our community. So we've talked about the struggles that my brothers have gone through when they felt like they can feel comfortable coming here to us through that. And Abdi's one of the biggest community leaders in our community. So they also have trust in him. And overall, I think that's how we've been able to support and help the communities that we serve. And of course, we bring a little bit of our culture and who we are into our businesses. And I've seen other communities be like so happy and passionate about the work that we do because we are family oriented, we are village oriented, support each other, go through things together, go the extra mile for each other. So a lot of our clients are coming back and referring people to us daily because they feel that in themselves. And I know that it's hard in our Western society to have that like family orientation and that community, and everybody's kind of on their own, and well, for us we just don't do that. So
Yeah, I mean, guilty, so I'm curious, as an outsider, can you just go into a little bit about, can you try to paint a picture of what that might look like for someone like myself who I don't have any sort of context for, I mean, when you say sort of on your own as a Westerner, like I resonate with that, right? It's like I see my parents very rarely, like I try to a lot, but it's like we're all spread out. I don't have a community, and I'm curious what that looks like, for you as an insider, and paint me a picture of what that would look like for someone.
yeah, we've seen clients who honestly, like a lot of our clients obviously go through a lot of trauma, and mental health and SUD is not something that just kind of stumbles on people. It's honestly through traumatic experiences in life, and not having family or people that support you is very difficult. I know that like for my brother and a lot of our people in our community, we tend to actually overdo it sometimes with our love and affection, because I know that my brother was never sleeping on the streets. I know, and he didn't have a house, and he was never hungry. He was never without a shower. He was never without clothes or anything because literally the entire community was supporting him. And so we don't actually have a community where we're like, oh yeah, we have a person that's homeless over there. He's on drugs. Oh yeah, okay, that's not our business. We just can't. So working here and seeing a lot of people that just need a lot of support made us dip into our own pockets and dip into our own funds to support clients as far as we can and be able to just provide the basic things at least like food, shelter, housing, hygiene products. We created little hygiene gift bags for clients when they first arrived, just to make them feel comfortable and not feel out of place, or make them feel like just because they're from the streets, that's where they belong.
James, I'm
Yeah.
just going to jump in here and say, like, that is the norm within the recovery community. And especially in Oregon, I hear it from all of my organ providers. They are all doing the same thing, making sure people come in, they have hygiene products, they have a place to stay, they have the things they need to start the process of healing from addiction and mental health trauma issues.
When I think that's got to make such a difference for the patient populations that you serve, kind of leading obviously from care, but it sounds like with this is such a bad, but like, leading with the sort of the love and heart, right, where it's like I'm gonna treat them like a human. And sometimes having that like hygiene kit, it's a small thing, but it's kind of actually a big thing if you have never been sort of had that or treated that way. If you're homeless, I would imagine that little type of thing would go a long way. um well, that's wonderful. I'm curious, you also sort of mentioned that there have been changes in Portland. I'm curious just from at a higher level, what has sort of that been like? Because I think Portland has seen a huge influx of homeless and addiction issues over the last 10 years or so. What's that been like, sort of living in the community and sort of seeing that unfold? What's that impact been like?
Honestly, it's been very scary and hard to maneuver around because we do have youth that are in the communities, and they get to be exposed to all of these things. And I've seen and worked with kids in schools and stuff, and they're exposed to these things. They are more prone to being in a situation like that. And I think it's really up to the governors and the mayors to really do something about it. And I think they are. And I think Oregon, the good thing about it is the amount of funds that are being allocated to support these people and their problems, and like how we can come together, like as you said, as a community to support them. So it's been very good to see that a lot of people are opening the clinics like this and sober living homes, and are able to make a living out of it, but at the same time be able to support the community in a way that it's our city, it's our town, it's our state, and we're trying to do the work and supporting these patients and clients that need the most help right now.
Yeah.
And recognizing that it is a health crisis. You know what I mean? It's not just something to turn the other cheek or, oh, I guess will help. It's a crisis nationwide.
Yeah. What has been the experience? Because Harbor of Hope has been open for what, 2 years ish now. What's been the experience of opening a facility sort of in the midst of that crisis? What's sort of been that journey for the Harbor of Hope team for the past couple of years?
I think in the beginning it was a little bit smooth. I wasn't really here for the most part in the beginning. I came midway, but once they opened the facility and had a place, and finding clients wasn't really difficult, and finding people to do the job wasn't really difficult because we had a lot of people ready to support and ready to help. I think the biggest struggle for everybody that I've talked to was mainly on insurance and policies and procedures, on maneuvering through those red tapes to support the clients. But I think that a lot of people have been able to open their own facilities. Unfortunately, some people are closing because it is, like I said, the red tapes are making it difficult to keep the place running and paying for itself. So other than that, I think that it hasn't been such a hard journey to start,
But
but
the
working
main,
through it is difficult.
yeah, like just working through the sort of insurance requirements and actually getting paid, or
Getting paid honestly has been an issue. Authorizations and having to deny clients care that you know they need, but insurance won't cover those. So either stepping people down that need more higher level of care, or just not being able to support that client because insurance won't cover them, and getting their insurances to accept authorizations as quickly as possible to ensure that they are able to be part of the programs has been difficult.
Yeah. And was think Abdi was keeping the facility open,
For 9 months.
I think, for that, right? What is, yeah, can you kind of go into, I'm very curious about the story because he was, I think, Carmen, and maybe you could as well, where it's like you guys weren't getting paid by insurance or certain insurance, and, Abdi was having to like pay out of his own pocket to keep it open and stuff. I think, is that,
Yeah,
do I
so
understand that correctly?
one of the major payers in Oregon paid them as they should for months and months, and then something triggered within the insurance company to send a recoupment, a huge recoupment. It was like $234,000. And at that point, I want to say from October, so like 9 months, there was no money coming in. It could have been maybe 10. No money coming in at all. And Abdi kept his doors open, continued to render care, provide housing for individuals without any kind of revenue or reimbursement coming in, while in the interim, our team fought the battle that needed to be fought. You know what I mean? So it was hard, but he was the facility that could and kept going. You know what I mean? Because of the community that he was serving. He knew that he couldn't shut his doors to people that needed help. So, yeah.
Yeah. And Nasteha, what does something like that mean to the community? For someone like, for Abdi and for you, Harbor of Hope, to do that for the community. I mean, what is that? Can you talk a little about what that means to?
I mean, it honestly means a lot more to them than it does to any of us. Obviously, it's very difficult to keep your doors open without any revenue or any, solution in sight. But you just throwing people out back into the streets, especially that need treatment, that are going through trauma, was difficult. And finding different facilities that will take them was difficult because a lot of facilities were kind of going through the same thing as well. So it was a really big struggle for a very long time. And honestly, I didn't think that we would make it through, especially given that, Abdi was, going through his own funds, like there's no tomorrow. So I honestly am just happy that we kind of jumped over that hurdle and we're still working through that. But it was just something that, inspires you to continue to do more regardless of what it is. And that, we understand that people's lives matter, and just saying, yeah, we're going to close our doors. And you have to think about staff that are working and are relying on this income for their families. We have to think about clients who have nowhere to go and no place to, lay their heads, but are doing so well in treatment that they're almost at that point where they're making a breakthrough. And, a lot of our clients, when we do graduations, they make me tear up and cry because from where they started to where they are, you would never think that this person was gonna, make it to this extent and, change to this extent. Even one of our clients is working for us now. So it just makes such a huge difference for the community and the people that we support, of course. So it meant a lot to us too.
I mean, and I think there is that, actually being able to see how much your work matters. I mean, literally, when we talk about changing lives,
Yeah.
that's not an over exaggeration. And being able to see that, I would imagine, I would imagine just being very fulfilled, I
Yeah.
would think. Can you talk about, so we'll get into the community aspect later, because I do want to talk about that, but I think this is just a natural segue. I'm curious, for what you guys were going through, sort of that journey where it hasn't always been easy, but can you talk about how someone like Prosperity, as a partner and working with us, what are the things that we've done that have sort of earned your trust and Harbor of Hope's trust over the years? Are there things that we have done that have sort of helped the business and made a difference on your behalf and on behalf of the patients that you're helping change?
Yeah, honestly, I mean, we've had a different billing company that we were working with before, and I didn't even get to speak to some of the people that work there. So it was very nice to see, Carmen coming in and, taking over and being welcoming and supportive and, you know, making sure that it was a collaborative thing and everybody in the facility was involved and figuring out how we can make sure that we get what we need to get done. Authorizations are sent correctly. And just in general, like I think Carmen has played a big role in kind of also keeping Abdi staying through it all and like, hey, we're almost there. We're almost at the finish line. Just hang in there. And I think that that's helped him and helped us too, and continuing the work that we do. So Prosperity honestly has been the reason why our doors are still open and we're still working through what we're doing and wouldn't be here without them, especially Carmen. So we really appreciate it. And Carmen's team is awesome. So everybody in the team has been very wonderful and supportive, and it's been an amazing journey with them. But she's
It
been
was hard. There
amazing.
were some days, I mean, nights that Abdi would call me and his spirits weren't high. He felt broken by the system of insurance. And that is, when they're withholding care to individuals who need it because I don't know, there was a lot of red tape and there has been for years. And I think now we're starting to get through it. I built a relationship with top players at the insurance. I don't know. I don't want to say I'm a hustler that way. I just think it's the fact that I feel like if I make these professional relationships, since Prosperity represents so many of the customers in Oregon, that they'll see my face enough times to be like, okay, we need to trust what Carmen is saying with regards to these facilities. So we have been given confirmation now that they're in the back rooms now saying, oh my gosh, like this is a national health crisis. Things are going to be changing. We do have to quit having so much red tape around the payer, which, you know, especially when it's Medicaid.
What's next for Harbor of Hope? What, are you guys looking to do with the business in the coming years? And how are you looking to continue to serve the communities that you serve?
Yeah, we definitely want to expand and kind of work in collaboration with different organizations. I think that it's very important that we collaborate with different organizations, that we expand, and that we're able to provide some kind of housing and shelter. We might have another facility sometime soon.
Yeah, Abdi wants to expand care. So our residential, they just render lower levels of care right now. And so, Abdi has a house already, and he wants to expand. So
And I want to end because I think one of the thread throughs of this conversation, I think the Harbor of Hope story in a lot of ways, and at least from what I've heard, is um the importance of community. Like, I think for Abdi too, like, I would imagine there's a great deal of stress of, like, if you close your doors, you're failing your community as well as part of it. I would think a little bit, but I just want to hear from you. Like, can you just talk about, earlier we did talk about, like, it takes a village, but it sounds like for you, your brother, the Somali community, the almost having too much love. But I want to hear, can you talk about sort of the community that you're building, Harbor of Hope? There's also other businesses now too that are now opening in the recovery space that are kind of an outgrowth of Harbor of Hope. And I just would love to hear about how, what that looks like and what that sort of means to you as sort of part of that community.
Yeah, I mean, honestly, for us, like having other facilities open up and other community partners, connecting and collaborating with them is very important because that just allows us to support more people. I know that a lot of people, when they open businesses, they're kind of to themselves and, they want everything to themselves. But the way that Portland is set up and I want to call it a epidemic, is that what it's called?
An epidemic?
Yeah,
I
yeah,
yeah,
mean, it
of like
is, yeah.
what we're dealing with. Yeah, there's so much to go around, and like we need to all kind of have all hands in, and everybody's able to support the clients and individuals that really need to be served in the community. And hopefully, insurance will figure out that these red tapes are only hurting their patients more than anything. So we're hopeful and we're just kind of excited to collaborate with more people and get more people into opening facilities like this too. So yeah,
Amazing. Well, thank you so much for your time
thank you.
and for sure of sharing this story here at Prosperity. I think, and partly because of Carmen, um, we are all just, big fans from afar and cheering all of you on. And so we can't wait to continue to help support you however we can and follow that growth journey and sort of help you guys succeed. So, thank you
Thank you so
for
much.
for really doing sort of the work that you guys are doing.
Thank
Really
you so much.
appreciate it.
Yeah, we couldn't have done it without you guys. So I
Yep.
appreciate your help too and support.
We're a united front, and we're just going to keep on fighting to
Yes, we
fight
are.
another day.
Yes, we are. Thank you so much, Carmen.
Thank you.